Explant's basically a removal of a breast implant. There's a lot of different ways to do it. The way that I typically do it is to remove the breast implant and to remove all the scar tissue around the breast implant, which is called a capsulectomy. We became one of the premier places for people who had breast implant problems. So over the past 10 years, I don't do a volume practice, but we've probably done more explants than anyone in Miami. We also do a lot of fat transfer. We'll do liposuction and contour the abdomen, contour the love handles, wherever we can find fat, and then we'll fat graft the breast to try to give a little bit better shape to the breast when the implants are removed. Patients who do not want their breast implants anymore are candidates for this procedure, but for whatever reason they want to have their breast implant out, I talk to them and kind of guide them through the process and show them photos of patients who've been through similar operations. Explant surgery is tough because sometimes you have patients, they'll have smaller breast implants, they needed a breast lift maybe, and they have a decent amount of breast tissue. And those patients, sometimes we can give them a better result than when they walked in the door. Conversely, sometimes you have patients with very large breast implants, very thin skin. Those patients are a lot harder because you don't have the breast tissue to shape anymore. The downtime is often very similar to the initial breast surgery where they got their implants. My restrictions on really strenuous activity, CrossFit, high intensity training, I make them take off 6 to 8 weeks. For light exercise, things like that, it's 1 month. Explant surgery is a safe procedure. We're operating on the breast, we have a board certified anesthesiologist, and we're operating on healthy patients. The main risk that we're worried about is what's called post-explant breast deformity. But overall, it's a very safe procedure. As we saw more and more explant patients, what was amazing is the level of patient satisfaction. I can tell you to date, I have no idea how many explants I've done, but I don't remember one of them that came back and said, I want a breast implant put back in after they made the decision and after we chaperone them through that process of making that decision.